Hello everyone, I am Dr. Anupam here and today we will discuss about a very important topic, nebulization in ICU. This may be the most common procedure that is done in the ICU and I feel it is most of the time the least understood or very incompletely understood subject matter. So let us discuss and try to clear our doubts. So what is nebulation in ICU? It can be defined as creation of aerosols and transport to target organ, right? And target organ in this case is our respiratory system, especially the alveoli, right? So how to create the aerosol? First, what is an aerosol? An aerosol can be defined as liquid or solid suspension in gas. So you want to send a liquid particulate matter or a solid particulate matter to a certain place. Who is the best vehicle? Gas. So is there a process where we can mix the solid or liquid into gas and carry it to the target organ, the alveoli? Yes, that is called the aerosol. So we have to have a device which can create the aerosol. So we require device to create the aerosol. What are the kinds of devices we have? We have jet nebulizer, we have mesh nebulizer, then we have ultrasonic nebul, right? So once the aerosol is created, now the second is it has to be transported. So how it will be transported? It can be transported via using the respiratory system in a spontaneously breathing patient, or it can use the mechanical ventilator. Correct? So these are called the transport medium. And what is the target organ? Target organ can be number one, airway, which can be proximal and distal. Second, alveoli. Third, systemic in some rare cases. Right. Now, what is transported? What is the transported material? Is there drugs that we send? We usually use amikacin, tobramycin, cholesterol. Of course, we use steroid, bronchodilators, or definitely we use Heliox also, right? So in this you have to remember the aerosol has to be created by a device that can be jet nebulizer, mesh nebulizer, ultrasonic nebulizer. Now once it is created, it has to be transported to the target organ, and the target organs are airway or alveoli or systemic absorption. And how it will be transported? By using the respiratory system in a spontaneously breathing patient or a mechanical ventilator, right? And what are the transported material? Mainly we give some drugs, for example amikacin, tobramycin, cholesterol. We also can give cephalosporins like ceftazidime. We also can give amphotericin B also. We will definitely give steroid, bronchodilator and Heliox. Now coming to the types of device, let us discuss in detail. So what is a jet nebulizer? The jet nebulizer is the most commonly used nebulizer in the ICU. It is very cheap, but it is inefficient for the fact that it produces particulate size more than 5 micrometer. So the ideal drug aerosol size would be 2 to 5 micrometer. This is the ideal. But the jet nebulizer produces larger sized molecule. So it is not that efficient, but because it is very cheap and portable, lightweight, it is used the most. Right? So how it works? So jet nebulizer works with two effects. One is called venturi effect. Another is called Bernoulli's effect. What is venturi effect? Whenever a high flow of air is flowing through a narrow pathway, its velocity increases. Whenever its velocity increases, it produces a surrounding area of low pressure. This is called venturi effect. What is Bernoulli's effect? Whenever there is an area of low pressure, if there is some liquid is there, then it will be drawn into the jet stream in the form of mist or aerosol. Right? So with these two principles, jet nebulizer work. What are the components of it? So here we have compressed gas. This is the drug chamber which contains the drug. This is the capillaries to carry the drugs, and this is the baffle. What is the function of a baffle? So here the mist will be produced, and the larger sized mist will be trapped by the baffle. Only the smaller sized aerosol will be transported through the oxygen into the patient. So this is the aerosols, right? So then what is a mesh nebulizer? Mesh nebulizer is the most efficient kind of nebulizer for the reason that it produces smaller sized molecules or aerosols, but it is very costly. So usually you do not find it to be used in the ICU. And another disadvantage will be it cannot be used to produce aerosol from viscous materials, right? So what are its components? It works to the principle of micropumping action. So this is the mesh down here. If you take a cross section and zoom it, you will find this aperture looks like this. This is the aperture. A liquid comes through the micropump and there is aerosol generation. This is the aerosol. This is the mesh. This is water. Right? Can produce aerosol size of less than 5 micrometer. Duration is less, so it can give large volumes in small time. Disadvantage is very heavy, not portable, costly, and it produces a temperature of 10 to 14 degrees centigrade higher. So there can be thermal deactivation, and it is not suitable for viscous solution. Viscous solutions cannot be given. These are the disadvantages. Right. What is the advantage of jet nebulizer? Advantage will be cheaper, portable, good for viscous solution. What is the disadvantage? Inefficient, requires an additional tube, right, produces particle size more than 5 micrometer. This mesh nebulizer is most efficient, but it is very costly, so rarely used. Now we'll discuss the target site. Now once the aerosol is generated, it will use our respiratory system via a ventilator and it will be delivered to a target organ. So what are the target organs? If this is airway, if you divide the airway into 16 generation, the first 10 generation and the second 6 generation. So in the first 10 generation, the mode of delivery will be inertial impaction. Here, this is inertial impaction. When you're providing aerosol, it will go and hit the wall of the airway and it will deposit there. That is called the inertial impaction. In the second 6 generation, it will be gravitational sedimentation, right? What does it mean? As the air or the aerosol containing air will go in the airway, the gravity will make some of the aerosol to sediment, to sit down, to settle in the airway. That will be the next generation. Then what happens to the distal alveoli? So this is the major mechanism how aerosol is delivered. This is by diffusion or Brownian movement. So this is diffusion, right? This is sedimentation or gravitational settling, right? So diffusion or Brownian movement is the most major way how the aerosol is provided to the target organ. And how to understand it? Just imagine for a moment you are lighting incense stick, right? When the incense stick is lighted, the smoke will travel. You can see the smoke traveling around. This is the diffusion or Brownian movement. So the fragrance get reached to a distance location, right? In the same way, it is the diffusion that will carry the aerosol to the alveoli. So this is the major mechanism. So how to maintain this diffusion we'll discuss in our next class. But for today we have discussed what is nebulization in ICU, the definition of aerosols, what is the requirement, a device is required, target organ is required, a medium of transport is required and transporting material is required. And we have discussed in detail about what is a jet nebulizer, what is a mesh nebulizer, what is a ultrasonic nebulizer, and we also discuss about the target site, what is the major mechanism of deposition of the aerosols, and we have discussed that the diffusion is the most major mechanism by which aerosol is deposited. Thank you very much.